My name is Amal Nirgudkar. I'm the CEO of Patient Prism, and I'm discussing patient experience with Christina Villarreal from Dental Associates. And Dental Associates is one of the amazing DSOs based in Wisconsin that focuses a lot on delivering this amazing patient experience, which improves outcomes on many, many levels. The question for you is, patient experience can fall apart, right? In many, many different ways. What are the top 5 ways, 5 things where a patient experience just falls apart and the patient stops from really engaging with the practice?
That's a great question. First, our website, the website. Patients want to research everything. So having our website up to date, having information that they want. So we have videos on our doctors that tell patients about themselves. We have patient reviews on our website. They can find out about the different specialties that we offer and request an appointment at one of our locations. So I think if they have a good experience right away on the website, and they know that we are very current with what we do, that that helps them take the next step to either requesting an appointment online or calling us. Which leads to the second place where patient experience can completely fall apart, is that first phone call. So the importance of using Patient Prism to monitor the new patient phone calls, make sure that we are doing our best on those calls, listening, building rapport, talking up our doctors, our hygienists, the staff, and letting patients know that we are the place that they should come and have their dental care. So really taking care of those patients on the phone is extremely important. That's a make or break for any.
Because if they don't,
clinic.
then they don't show up, then you can't do anything about it.
Exactly.
Right? The patient's got to show up.
Yes, exactly. And then from there, at their first visit, the front desk, the reception area, look around. Is it up to date? Is it clean? Listen. What are the patients listening to? The welcoming front desk, the staff members, are they smiling? Smile, smile, smile. And just being welcoming and taking care of patients, keeping them up to date. If there are any, delays is very important, obviously, keeping that communication open. And then, of course, being brought back into the operatory area. So that interaction with the dental assistant and the hygienist and the doctors is so vitally important. If at that moment that patient just isn't feeling that connection or really feeling like they're being cared for, they're not going to come back.
Sure.
So it's just extremely important to make sure that we are doing our best and taking care of the patient and working together as a team, communicating. We don't want a patient to see that there's a disconnect between
the
anybody that, any of our staff that are helping that patient. And that last part of the appointment, with the patient leaving, the patient being escorted out, thanking the patient for choosing us as their dental provider, and making sure that their experience, went very well, and making sure that we're sending them off, to enjoy their day, and really thanking them for making us their dental home.
So obviously at the end, because you want them, for the most part, there is a follow-up appointment.
Yes.
And that, I guess, so those are the 5 ways. There's many ways, I guess, you could mess up in terms of delivering patient experience. But these 5 things, your website, your phone calls, the front desk and reception area, what happens in the operatory, and then end of the appointment. These are the top 5 reasons. Top 5 things where patient experience could really, really fall apart and lead to, not the best outcome. So thank you for the discussion.
Thank you.